at the site of injury. See here, they are abundant at the site of healing in the connective tissue. For example, if there is any what we call as injury, what will happen? They will form the, what are they? They are the fibers from the fibroblasts, because you know the function of fibroblasts is to synthesize the protein fibers like collagen fibers, elastin fibers, reticulin fibers, and these fibers these fibers, they form one meshwork, they form one network. You can see now. In this, yes, what happens is while this WBCs, RBCs, and platelets means whole blood, it's going na this area, it traps the WBCs, RBCs, and platelets. WBCs, RBCs, and platelets. It forms one blood plug. When blood plug is formed, so it does not allow the bleeding. When it stops the bleeding, thereafter the process of healing starts. If you want, you can take screenshot. Somebody tries to join. Better. So now let's talk about the adipose tissues. Adipose tissues, you know what are the adipose tissues? They are nothing but they are the fat cells are what we call as the lipocytes. They are oval in shape and they are round or polygonal, and their average size, the average diameter are these 50 nanometers. And while talking about the nucleus, it's only one at the side, not at the center. And while talking about the cytoplasm is the peripheral ring of the cytoplasm. There are the fat globules present. You know, there is the presence of fat, like when the fat is in the form of a round shape, we call it as fat globule. So there are the fat globules present. There is a signet ring appearance. You know that signet ring appearance, like what we call as the circular ring appearance. And while talking about the function is the formation and storage of fats. While talking about the macrophages, and I told you these adipose tissues, they are mainly present below the skin. Yesterday I gave you explanation why, day before yesterday, why the girl's skin is more soft than the boys. I gave you the explanation of that also. So while talking about the macrophages, they are also called as the histocytes or nomadic. What we call as a nomadic? Nomadic are the things, nomadic are the people who don't have their own house, who don't have their own home. What they do, they wander from place to place in search of food and shelter. Remember class, UKG, first, second, third. At that time, what we were learning, that early men, they were nomadic and they were wandering from place to place in search of food and shelter. Similarly, these macrophages, they are the nomadics. They are like early men. And they do not have macrophages. They do not have their proper, the proper habitat. They don't have their proper accommodation. So that is the reason they are moving throughout the body with blood. And they are irregular in shape and they are philopodia. They are 15 to 20 nanometers in size. They have the small nucleus indicated. The nucleus is the kidney shaped. While talking about cytoplasm, there are the cytogranules. Actually, they are the small granular structures inside cytoplasm. And there are the formation of vacuoles. And when we are going to scan these cells, they scan deeply. But it's not of your importance staining. It's important for those who are doing the DMLT, lab technician. So while talking of the function, the macrophages, they are phagocytic in function. Phagocytes means the cells which eat another cells. For example, these cells eat bacteria. These cells eat bacteria, virus. Phago means eat. Cyte means cell. So they are the cells which what we call as the cell eaters. So another thing is cyte. So many together form giant cells. These macrophages, as I already told you, that they don't have particular site. They are the nomadic, but they sometimes together form one giant cells. So another cell is what we call as the mast cells. So mast cells, there are the shape is round or oval, size is 12 nanometers, nucleus is centrally located and small, and cytoplasm is cytogranulous and basophilic, and function is to secrete histamine and heparin. That's the note mark point. The function is, sorry, the function is to secrete histamine and heparin. Remember this throughout, because this will be important throughout the year. And histamine and allergy, the site is, they are more abundant in inflammation, allergy, and hypersensitivity. You know what's inflammation? Anyone knows what's inflammation?
Swelling.
Okay, there is one component, that's what we call the swelling. Inflammation means when a person has injury, thereafter what happens to his body, that part goes for first redness. Then there is increased temperature, there is heat at that very area. Then there is a swelling, and there is a pain. So these four cortical signs are called as inflammation. Everybody understood? What is allergy? What is allergy? What is allergy? Anyone? Okay, I will tell you. Allergy is the overactive immune system. Immune system becomes overactive, and immune system becomes overactive, and similarly is a hypersensitivity. It's one of the type of allergy reaction. And at this time, what happens is the immune systems, they become overactive, and immune system starts forming the antibodies against non-pathogenous things. For example, if a person is wearing the jewelry, our immune system start forming the antibodies against the jewelries also. Our immune system start forming the antibodies against some type of clothes also. This is the allergy and hypersensitivity, and you will study it forwards when we go through the immune system. I hope that you get the idea. So another cells is the plasma cells. Plasma cells, they are formed by the B lymphocytes. Remember the immunity again, B lymphocytes and T lymphocytes are B cells and T cells. And plasma cells, they are formed by the B lymphocytes, and they are round or oval in shape, and their size is up to 15 nanometer. And while talking of nucleus, their nucleus is spherical and eccentric, and they are the cartwheel appearance. Cartwheel appearance, and this is the cartwheel appearance. So this appearance of the nucleus is cartwheel appearance. Tissues, while in adults there are the, what's the meaning of fetus? Fetus means small baby. So let's talk about adult only, because fetus is not necessary for us. So because fetus is somewhat similar, there is only one or two differences. What we call as adult connective tissue. There are the ordinary connective tissue and specialized connective tissue. For your information, I would like to tell you, these classifications, you will find different classification in different book. You don't need to worry. Whatever is best for you, go through that. Okay? I found this very easy. That's the reason I told you to go with this classification. So the connective tissue in adults have two types. One is ordinary connective tissue, another one is specialized connective tissue. So again, while talking of the ordinary connective tissue, there are the two types of connective tissue. One is loose connective tissue, one is dense connective tissue. Okay, I told you before what are the loose connective tissue. In loose connective tissues, what's happening there? the cells are, the cells and fibers, they are loosely arranged in a semi-fluid, what we call it, the semi-fluid ground substance. So what happens, there is a loose arrangement. For example, these are the fibers, these are the cells. You can see, na? You can see, and this is the ground substance. So there is what we called as the loose arrangement densely present. But what happens, there is no proper orientation, there is no proper direction. They are directed in all possible directions. That is the reason we call it as the irregular connective tissue. While talking of the regular connective tissue, the examples are the tendons, ligaments, aponeurosis. Okay, what are the tendons? Anybody?
Muscle to bone, the joint.
Yeah, exactly. What happens, for example, this is the muscle. For example, this is your biceps. Okay. Thereafter biceps, what happens? The muscle, it becomes flat, and this becomes what we call as a very hard and tough-like structure. This is what we called as the tendon. Okay. Then this tendon gets attached with the bone. For example, this is your biceps muscle. Example. And this biceps at the end, it becomes very tough and hard, and thereafter it attaches with the bone. It's called as a tendon. So this is made up of, these tendons are made up of the dense regular connective tissue. And another example is ligament. What is ligament?
Attached to bone to bone.
Yeah, exactly. The attachment between two bones is called as the ligament. For example, there is what we called as the, for example, this is one bone and this is another bone, and I form it one joint called, can anybody tell me which joint is this?
Synovial joint.
Synovial joint.
Yeah, what joint? Joint of what?
Knee joint.
Yeah, exactly. This is knee joint. So you can see there are the ligaments here. For example, this is the ligament, and this ligament is called the, it's present laterally, we will call it lateral collateral ligament. If it is present medially, we will call it medial collateral ligament. And ligaments are the, what we call the tough sheets, are the tough, dense regular connective tissues that connects to bones. Everybody understood?
Yes.
Sir.
Fine. So then there is another, is the aponeurosis. What is actually the aponeurosis? Aponeurosis are the tendons again, but when the tendons are flat, we call it as the aponeurosis. The flattened tendon is called as aponeurosis. So then there is irregular dense connective tissue. The dense connective tissue irregularly, it's found in, example is the subcutaneous tissues. Sub means below, cutaneous means skin. So the tissues present below the skin called as the subcutaneous tissues. So this is the example of the irregular dense connective tissue. So irregular dense connective tissue, they are seen subcutaneously. Then while ordinary is completed, so while talking of the what we called as the specialized tissues. The specialized tissues, these are the tissues, for example, this includes the blood, this includes the cartilage, this includes the bones. You know what's blood very well, so I don't need to do the explanation of the blood and how it connects. I had told you yesterday, day before yesterday also. But for those who are attending the class for the first time, I would like to tell them that blood, it circulates throughout the body. That's the reason every part of the body, it's connected by the blood. So that's the reason it's the connective tissue. It's what we call as a specialized connective tissue. There are the cartilages. Anybody can know what's cartilage? Anybody?
Soft bone.
Yeah, exactly. It's not like a soft bone. Before the soft bone, what is, during the bone formation, first there will be the formation of cartilage. Then this cartilage, it's converted into bone. But this cartilage, it's very soft and it's present over the joints. Those who are non-veg, Those who are eating chicken, I will tell them when they are eating the leg piece, na?
Yes, sir.
Oh, this become the good leg piece. And thereafter, the back piece is like this, na? The back of the leg piece is like this, na? Isn't it?
Yes, sir.
Yes, sir.
Okay. And you can do one thing. You can eat this much also. This is very soft. So this is what we call as the cartilage. This is what we call as the cartilage. Everybody understood? And the bones, they're also the specialized connective tissue, so I don't need any explanation. You know these things very well. If you want, screenshot. Anyone? Okay, let me tell you that dura mater, it is the one of the covering of pia mater, dura mater, arachnoid mater, subarachnoid mater, and dura mater, it is one of the coverings of brain. So dense regular connective tissue, I told you what is dense regular connective tissue. When there is the what we called as the proper orientation of the fibers, and what happens in this, there are the less cells and ground substances pointed in the particular direction. They have the tightly packed coarse collagen bundles arranged in parallel fashion to form a cord-like cylinders. Tendons and the ligaments are sheaths aponeurosis. If the bundles are arranged in what we call as the cylindrical pattern, we call it as tendon. If it's present in flat pattern, we call it as aponeurosis.
Aponeurosis are between the two ribs.
Between the
Rib cage में होता है sir aponeurosis.
It's not like only in rib cages. Even for example, for biceps, there are the bicipital aponeurosis. What happens is when the tendon is flattened, it is called as, for example, this tendon, and this is a cylindrical tendon. Okay, when the cylindrical tendon is flattened at the lower portion, it's what we called as the aponeurosis, like this.
समझ.
So is also called as a white fibrous connective tissue. Screenshot. Thank you very much. If anybody wants to
Thank you,
contact
sir.
Guys, audio ഇഷ്ടമായെങ്കിൽ please subscribe the channel.